Well, for two reasons really. One is that in terms of human rights, and people talk about human rights including the right to citizenship, so that's the right to have your birth registered, and obviously if you're going to register births you need to register deaths to mark the end of life as well. So that's purely the registration bit of it, but for health it's really important to have a cause of death in medical terms also assigned to why people died, because why somebody in a population has died tells you a lot about the health of people who haven't died, the health of the people in the population that you still need to be caring about and prioritising. So, you know, you would not want to order a whole lot of HIV treatment in stock if you only had 1 in 100,000 deaths that were due to HIV, for example. We live in a very unequal world, and WHO estimates that about half of the deaths in the world are not registered with cause. Half of the deaths in the world means about 30 million a year, so this is not a small problem. And actually it's not random either, so there are many countries in the world that successfully register 90-something% of their deaths and give accurate causes, and there are other countries in the world that fail to register 90-something% of their deaths and not give them causes. And obviously, you know, I don't think it's any big secret that that's an index of general development and infrastructure and social development and wealth and everything else. So we're basically talking about lower income countries where lack of registration is a problem. So it would be a much smaller problem globally if it were half of the deaths in every country that were getting registered, because at least then you'd know something about every country, but it's not that. Well, research isn't going to cover the 30 million unregistered deaths per year, so it's important to realise what research can't do, and researchers are not death registrars, so that's not the objective. But what research can do is provide good methods and tools that countries can use to actually make it easier to register reliably causes of death in places where otherwise it's not happening. So, for example, computerized models for assigning cause of death, as WHO and ourselves have been working on, a very important part of that toolkit.